Okay, it's 1:05, and I believe we have 323 people with us today. That is crazy exciting, especially for a Wednesday afternoon. Thank you for spending time with us. Like I said earlier, my name is Samantha Andrews. I'm the training manager from CATCA. I'm the staff member who helps lead our Wednesday webinar program or series. It is kind of a webinar series that kind of focuses on trending topics and also what I hear from the field that coalitions really need to hear about. I thought since it's September, everyone's getting back to school and we're kind of getting back into old routines, and parents and school administrations are seeing, hey, what need is in the community. A big one, dealing with the vaping issue among youth. I have two trainers with me who I'll be shortly introducing, and they'll be introducing themselves as well, Ricky Barton and Dr. Tanya Knox. They will be leading our training today and going over a lot of details when it comes to vaping for our youth population. I think I put in there twice just some cute, like basic housekeeping. At the end of this webinar, we'll have a Q&A. I'll be monitoring the Q&A box, but I also encourage you, use the chat box. We have over 300 people, so that'll be the best way for us to catch every question or anything just to follow up. Please use that. It's really helpful. And we'll save questions, anything towards the end. I know our presenters have some polls, have a lot of content to get through. So we'll be sharing like contact information, some follow-up materials, and of course, like I said earlier, you'll have the recording and the slides. Can you go to the next slide? I'm just going to read off so this is what I put in the chat, but I'll also read it. Don't forget to use the Q&A box. So we'll be holding bulk questions at the end. When typing in the chat box, I do this all the time. I forget to press everyone. Please do that because everyone is a wealth of knowledge and we need to utilize each other. In the next coming days, I will also be placing all of this on the CATCA Wednesday webinar series webpage. There's a lot of W's. I'll be placing that link in the chat, and then everyone should also have my email from getting like the reminders and everything. So if you have follow-up questions, just email me. And then at the end, you could get a pretty letter of attendance if you complete an evaluation. We love to hear from you. How did we do? How can we improve? What do you want to hear about in the future? I need to know. It's my job. Anyway, kicking it off to our wonderful presenters, we have Ricky Barton hailing from Missouri. Wait, I want to say it the right way. Missouri? How do you, is there, I want to say
Well, I say Missouri, but Missouri is the way some people might say it.
I don't know if I'm being insulting now. And then Dr. Tanya Knox, who I will be seeing in person next week, and it's going to make my month. No offense to everyone else. Hailing from Atlanta. So I'm going to turn it off to our beautiful presenters. Take it away, ladies.
All right, so welcome everyone. Welcome, welcome, welcome. So as we get started today, we want to know who's in the room. So who's in our virtual space, who's in our virtual audience. Thank you so much for going ahead and putting in your locations. We're going to do a little quick activity in just a second to see exactly where you are on the map. So we also want to know why you're here. So what brought you to this webinar Wednesday? Why are you in our virtual space and sharing our Wednesday afternoon with us? The quick facts that we have put together for you all on various vaping programs, as well as vaping resources and how to engage your schools, the successes and the challenges. So we have a lot of information. This is going to be a full interactive webinar. And so let's go ahead and get started. So again, my name is Tanya Knox. So I hail from the state of Georgia. So I am currently the program manager for two DFC, two drug-free community grant coalitions, one of which is in Auburn, Georgia, and the second is in Athens, Georgia, home of the University of Georgia, home of the Bulldogs. So go Dogs for any Georgia fans, but I am close to Athens, Georgia. I am currently a mother of three, a wife, and a recent grandmother to a goldfish. So I now have a goldfish named Winnie the Pooh Fish. And so welcome Winnie the Pooh Fish to our family. So I'll pass it on to my co-host, my co-facilitator, the wonderful Ricky Barton.
Well, thank you, Tanya. Hi, everyone. I am Ricky Barton. I do not have a cool pet goldfish. I have a dog, but that's not a goldfish. I am coming to you from Southwest Missouri. I've been here about 11 years, and my role in the state of Missouri is to provide technical assistance in the prevention field across the entire state, and then also a trainer for CADCA on both the youth and the adult side. And so really enjoy getting to do those things. I actually also, since I'm seeing people from other states I've lived in, I grew up in central Pennsylvania in the home of the Penn State Nittany Lions, and that is my alma mater. So we are Penn State. And then also moved down to Lafayette, Louisiana for 5.5 years before coming up to Springfield. So for my Pennsylvania and Louisiana peeps, also a shout out to you all. Excited to get started and talk about this vaping today. Back to you, Tanya.
Thanks, Ricky. So next slide. So we're going to annotate. So those of you all who are familiar with annotation tool, we're going to use that to mark our space on the map. So if you have not used annotate before, you're going to go to the top of the screen where it says view options and scroll down to where it says annotate. And you can scroll over stamp and pick whatever kind of symbol you would like to place on the map. And you can just show us where you're from. So I saw a lot of people putting their locations in the chat, but if you don't mind, put them on the map so we can have a visual of where everybody is. Okay, Brianna, it's okay. You can just put your location in the chat. If you don't see the annotate under view options at the top of the screen. See, 1 star.
A lot of people don't have that option. I wonder if the settings option is on. Yeah.
Okay. Well, that's okay. We see your locations in the chat. It's perfect. Well, thank you for trying. Thank you. I appreciate that. All right, so, I see. Oh, Iowa, Alabama, New York, Kentucky, Washington State, Vermont, Florida, Ohio, Athens, Georgia, West Virginia, New York, Montana. Oh, I can't read that fast. There's a lot of states coming in. Oh, we are all over the place. Thank you for being here. New Mexico, Indiana, Texas, Pennsylvania. I see Go Gators. It's okay. SEC rocks. I see some Hoosiers in the house. Wisconsin. Oh, wow. SEC does rock. Right. I agree. Oh, Big Ten. Arkansas. Yes. Kentucky. Well, thank you all so much for participating and putting your locations in the chat. It looks like we have covered, if not all the states, at least the majority of the states are represented on today's webinar. So thank you for being here. Next slide, Vicky.
Are you ready for the poll? I can launch
it. Yes, I am ready for the poll. So we want to know, excuse me, I'm sorry. We want to know why you're here. So do you currently have a vape program in your community? Are you currently utilizing one within your community? All right. The responses are still coming in. We're about half, yes. Give you a couple more seconds to submit your responses.
Yeah, it's looking like the majority of them do, Tanya, which is so great.
It is. It really is. We got almost at half people in our audience.
I think some are having trouble submitting as well. So we can probably call it there.
Gotcha. Sounds good to me. All right. So we have about half of our audience that currently utilizes one of the vape programs in your community, which is great. All right.
And then
what's the next poll question? I'm sorry.
The majority are using Catch My Breath, followed by Vaping Know the Truth, and then the You and Me Together Vape Free, which we'll talk about. Yeah.
That's one of them. And let's see. Seeing the question for number 4, as far as like which DFC or which grant it's associated with. But it seems like the majority of us are representing some sort of grant program or funding source that is also associated with the technical assistance that CACA provides. So thank you again for being here. All right. So we will move on. Oh, in-depth, that's another curriculum, Ricky. We didn't include that one, but someone also used in-depth as a curriculum.
Yeah, so we had 146
awesome.
people respond to that poll. Do you want the sector question next?
Yes, please.
Great, we'll launch this one, see if everyone's able to submit here. And I believe Samantha told us that it restricted the number of options for the 12 sectors, so we did have to combine some of them. So we aim to learn the 12 sectors, but we did have to combine and limit it to 10 responses only.
Right. So you'll notice that the healthcare professionals combined with the other substance use organization, and law enforcement is combined with the state and local tribal agents, government agencies.
For those of you who are making comments, I didn't create the poll, so I'm not quite sure why there are untitled questions in there. But if you just go ahead and respond to one of them, you should be able to submit. If you go ahead and respond to the questions that are extra in there, it was only intended to be one question, so I'm not sure what Zoom has done to us. But if you just go ahead and answer all 3 of those and then hit submit, you should be able to go through.
Yeah, we only had 6 questions listed because we reviewed this prior to we started. So I don't know where those empty questions are, but I know we only had 6 questions for this webinar.
Zoom has a mind of its own today.
Yes.
That must be working for folks because we're getting more responses now.
Perfect. Thank you all for bearing with us in our technical mishaps. So it looks like we have about 40% healthcare professionals and other substance misuse organizations, about 28% youth, I see, 17% parents, 22% schools, 5% business, 3% media, 10% civic volunteer organizations, and I mentioned 40% health professionals and other substance misuse agencies, 2% religious or fraternal organizations. And then something just shifted with my screen. Law enforcement or social local tribal agencies is around 17%. And then we have 33% youth serving organizations. Awesome. So we have a little bit of everyone at the table. That is great. All right. Next one is, are you a DFC grantee? So are you a grantee that is awarded by the Drug Free Communities Grant? So it looks like the majority of us are not DFC grantees, but we do have quite a few of our drug-free communities coalitions on the call as well. Awesome. All right, next one, next poll. All right, so are you a CARE grantee? So are you awarded by the Comprehensive Addiction and Recovery Act? So the vast majority of us are not CARE recipients. Okay, good to know, good to know. Perfect. So is anyone on the call a Stop Act grantee? So are you receiving funding for the Sober Truth and Preventing Underage Drinking Act? Perfect. So the vast majority of us are not Stop Act grantees. Okay. Thank you for that. All right. And so we're moving on. I think we have one more poll. Was that the last one, Ricky?
That is the last one for now. And it was so helpful to hear from all of you and what funding you have, what funding you don't have, what sectors you're coming from, because all of that plays a role in what we're talking about today, because you may have a very special role in helping to engage schools in vaping curricula. And so we're going to talk through, just to start off, how and why we got here. What are we doing? How has this problem even emerged to begin with? And then we'll talk about engaging schools. So for those of you who aren't aware of statistics around vaping, we know that it has been on the steady increase. It's starting to level out. We're seeing some leveling out of vaping, even some decreases depending on what ages you're looking at and what populations. But in general, we can all, and experts all agree, we're in the middle of a vaping epidemic. The 2022 National Youth Tobacco Survey provided the data here on the screen that they did an online survey of youth in last year and found that 2.5 million of our middle and high school youth are currently using e-cigarettes. So that is past 30-day use, that we understand that 2.5 million are currently using them in the past month. And of those users, about 85% report using the flavored e-cigarettes, fruit being the number one, and really anything sweet, candy, dessert, other sweet flavors. They're looking for that flavored e-cigarette for their e-cig of choice. And even maybe far more startling is that well over a quarter actually report using an e-cigarette every day. So this is becoming a habit. This is becoming a usual use for them. And so, you know, this just gives us a brief snapshot into the problem that we're facing and why we're here today, because we understand that there is a great deal of our youth who are currently using, and we want to bring awareness to that. So a quick walk down history lane. There's a lot of text on the slide coming at you, but it was interesting to review some history. So first, just a did you know, the first idea of an e-cigarette has been traced back to the 1930s. I was not aware that it went back that far. However, the prototype that Joseph Robinson created and the patent under there were, you know, kind of left in that prototype stage, never really developed into anything. And then kind of there was some history that evolved. So I was curious, you know, just to think, you could put it in the chat when you first recall hearing about an e-cigarette or vaping. And Tanya, I'm going to have you share your story in a second. I remember distinctly, I was living in Lafayette, Louisiana at the time, and it was probably 2008. And I was in an ice rink watching a hockey game. And I remember looking over, and this gentleman had, I don't have anything that's really a good representation. Let's just look at my stapler here. Okay. It was probably a box the size of this stapler. And he was puffing on this little stick that came out of it. And there's this giant box he was holding, and this vapor cloud would just, you know, leave his mouth in this ice rink. And I remember at the time I was working on a SPIF SIG grant, a state incentive grant down there in Lafayette, and working on underage drinking, drunk driving prevention. I remember looking at that thinking, what is that thing? Is that a cigarette? Can he be smoking in here? Is that smoking? And I was actually with the person who was working on that grant with me. We were both like really perplexed. And so we learned that it was, in fact, a very, you know, earlier e-cigarette, where it was this huge box, this huge thing. And my thought at the time was, oh my gosh, that will never catch on, ever, because that is ridiculous. That box is so huge. And who's going to want vapor clouds all around them? That, my friends, was about 15 years ago. And look at us today. We now have vape devices the size of a USB drive. We've got them inside of hoodie, you know, drawstrings. We have just all of these methods that we're finding that people are accessing their vapes. Tanya, tell them about the first time you saw a vape.
So mine was a little different. I was actually driving. And so I had my current 13-year-old, she was an infant at the time in the back seat, and we were stopped at a red light. And so all of a sudden I saw what I thought was smoke coming out of the car in front of me. And I said, oh my gosh, like the car is on fire. So I immediately like pulled over to the side to try to see if someone was in the car. And I looked in my window and I realized that the person was holding something that looked to me like a stapler, but they were putting it to their lips, and this whatever substance was coming out, and it was engulfing and covering the entire car. I mean, it was so much aerosol. I was like, oh my goodness, I thought the car was on fire. So I again thought that it was something that was not going to catch on, because I was like, who wants to walk around with that much smoke over their head and moving around them all the time while using this device? So I have been shocked since then.
Yeah, and it really has evolved. We'll go through a brief history, kind of starting in the 1990s. I saw some of you were aware of this in the late 90s. We saw that several different patents came out around nicotine inhaler devices, both by tobacco companies as well as private inventors. And then we started to see this, the Federal Drug Administration kind of came on scene in 1998 when they were denying access to e-cigarettes coming on the market as a drug delivery system. At that time, the FDA actually didn't have regulation over the tobacco industry. It was just about, they were able to regulate the delivery method of it. It wasn't until President Obama gave them the power to do so when he was in office, the FDA was able to start regulating tobacco products. But back then, they just denied that from coming onto the market because it was not an approved drug delivery method. In 2003, 5 years later, we see this Chinese pharmacist over from China, who is also an inventor and also a smoker. He developed the first successful commercially available e-cigarette. So he was really kind of the impetus of this starting back then in terms of it being available on the market. And then in 2006, it made its way to Europe as well as American markets. And then 2 years later, so really 10 years after that FDA first denied that e-cigarette on our market, the World Health Organization announced that they're not a legitimate smoking cessation aid, and actually demanded that they remove them from the market immediately. Because as some of you mentioned in the chat, early on, it was promoted very much as a smoking cessation aid. And so people were switching to those, and it was kind of marketed as that it will help you smoke less. And so by 2008, the World Health Organization was already identifying that was not really the case that was happening there. In 2009, the FDA actually ordered the U.S. Customs and Border Patrol to reject any entry of e-cigarettes. And then in 2009, as I mentioned, President Obama gave the FDA the power to regulate the tobacco industry. So that helps them to at least come on the scene in terms of regulating e-cigarettes by April 2011, just like traditional cigarettes and other tobacco products. If you look up the history of this, and I put my source on the slide, they have extensive history from way long ago, and that's where I drew all of this information from. But you can go and look there and really read more about that. But there was a little bit of pushback against the FDA for actually selecting to regulate those tobacco products, regulate e-cigarettes as tobacco products, because people were viewing them as actually more harmful, or other people were arguing that they're better and safer, and therefore they shouldn't be regulated that way. So just interesting history there. And then kind of, I just jumped into like the 2010s in general. We start seeing a lot of research come out around e-cigarette use. We see the promotion of it being safer than smoking, healthier than smoking. We see studies on the body and the impact that it's having on the body, whether or not it's useful for smoking cessation. We've been tracking youth use. And so there's just a lot that happened in the 2010s that was starting to steer the ship, if you will, on where we were going with vaping. So kind of, again, I'm skipping some history here, but kind of wanted to highlight on some of the major points that in May of 2018, the FDA officially sent warning letters to 17 different companies about their labeling and their advertising in a way that resembled kid-friendly food products. So that was the first time the FDA really sent out a warning about that. And then we see later that year that they sent out, there was a nationwide kind of a study and also a series of compliance checks that were done, and the FDA sent out over 1,300 warning letters about those who sold Juul as well as other vapor products about how they were branded and marketed towards minors. And they actually requested that those top 5 e-cigarette branding companies make a plan within 90 days of how they would change their marketing so it was not so targeted to youth. We then are starting to see, as our data was increasing later in the year, the Monitoring the Future data showed record numbers of youth who were vaping, and particularly all, cigarette use at that time was at an all-time low, meaning lowest ever in history since the question has been asked about cigarette use, lowest that we've ever seen in terms of a traditional cigarette use by youth, but e-cigarettes were skyrocket record high. So as those of you who have been in the prevention field a little while know, we sort of saw that exchange happen where youth stopped smoking regular cigarettes and switched to vaping. And so then we see in late 2019, the CDC publicly advised individuals not to be using e-cigarettes, and Walmart, as well as then CVS, banned the sale, and they are no longer selling e-cigarette products. January 2020, we see that the White House bans the sale of flavored vape cartridges and pods, except for those that are tobacco and menthol flavored. And then in 2021, FedEx and UPS announced that they will no longer ship vapor products, which again, there's some history there of some pushback and individuals really begging for them to bring that back. And so just an interesting note that all of these companies, what I didn't include was in the history, all of the states and nations and countries in the world who were banning the use, the possession of, the distribution of e-cigarettes from the 2000s all the way to today. There's still countries that are banning those. So just interesting history there. And then of course, April of this year, we saw the Juul had the $462 million settlement with, I think, 7 or 8 states where they resolved those lawsuits about them aggressively marketing to youth. And I'm not sure for those of you who had the opportunity to watch the Screenagers showing that Kadka had a few weeks ago. That documentary really showed how the vaping industry, specifically, especially Juul, because that was the court hearing about it, used methods from past successful tobacco campaigns to target youth, how the coloring and the brightness of it was very appealing to youth, and they specifically were found to have done that. So that definitely brings us to how we're here and why we're here, and that's kind of one of the takeaways, is that there's these factors that have contributed to this being very, very, very appealing to youth. We know that they targeted youth with advertisements that were bright, colorful, happy, young people who were using these, making it look very, very attractive to be using a vape or an e-cigarette. The flavors we've already mentioned, those are, as you saw in the data from last year, that those flavors are very attractive to youth. 85% of current users say that they are using those flavors, the sweet ones particularly. And so that's certainly a draw for those youth who don't want that cigarette flavor. And that they have been marketed as safer than traditional cigarettes. Excuse me. And so that is something to be mindful of, that when you're talking with youth or adults about this, that there are still a lot of health risks associated. So sorry, 1 second, let me just get a... I don't know about you all where you live, but ragweed is prevalent. All right, we're moving on. So sorry about that. Hang on 1 second. I'm not sure what's happening with my slides. There we go. The other reason kind of why we're here is because these vape messages around that safer use has actually we've seen that youth have found vapes to not be very risky. If you look at this data, I know some of the numbers are a little bit scrunched there, but we're looking back at 2014. The Monitoring the Future data showed that 12th graders and really 10th and 8th graders were right around that 14 to 15% said that there was great risk. So if you're with me on this, only 14 of our nation's 8th, 10th, and 12th graders, only 14% said that they think there's great risk to using an e-cig regularly. Thankfully, in the prevention field, this graph shows the trend that we always want to see in prevention when it comes to substance use, which is increased perception of harm. We are always wanting to increase how youth perceive that substance to be harmful, because we know that research demonstrates the lower perception of harm, there's usually an increased use rate, whereas higher perception of harm typically comes with a lower use rate. So it's good that it is trending upwards from 2014 to 2018, but this is important data to really look at to see how youth are perceiving the dangers of vapes. Hopefully this means that the marketing, the curriculum that we're going to talk to you about in just a little bit is making a difference on what they perceive to be harmful or not harmful. But this is still pretty staggering numbers when you compare this to marijuana use or alcohol use. You're seeing these numbers typically be lower than the perception of risk of regular use of alcohol or vapes. And so it's good to be mindful of these numbers because it really does show that they seem to perceive that vapes are safer than e-cigarettes. So Tanya, I know that you've also want to talk to them a little bit about some of that, also why we are here.
Yes, thank you. So we recognize at this point that we're working with a moving target. We recognize at this point that with vapes, it's changing constantly. There's a constant change of different substances. There's a constant change of information and data that's released. So we're constantly dodging and learning and trying to work with our community members to continue to educate them on different topics. Because I've seen in the chat and what Ricky just mentioned, it was introduced one way. It was introduced as a smoking cessation tool. It was introduced with nicotine only, but we have currently seen how that trend has shifted with our middle and our high school students and our young adults, where we are now seeing other substances like marijuana, THC, CBD products. So we're following the trends. We're continuing to educate and to learn and to research as prevention is, but moving on into engaging our schools, we also have to make sure that we're up to date on the information and we're constantly reviewing things and knowing and understanding that this is a changing concept. When I think about when my first experience with traditional cigarettes, there were no commercials out about traditional cigarettes, but when I talk to my youth now, they reference the commercial with the lady with the hole in her throat. And so I remind them like, okay, well, when these cigarettes were popular, when they were currently doing when they were working on the marketing and the advertisement for traditional cigarettes, there were no commercials that gave the consequences or the harmful effects of cigarettes. It took 40, 50 years before we got those commercials on the air for people to see those things. And so it's going to be the same process with vaping. So reminding our community members around that, reminding our schools around that it's going to take some time to get that research, and it's going to take some time to develop all the information that we need to create the data and to show the trends that we're seeing currently with vaping. Next slide. So when we see the different substances that are changing, so we're seeing marijuana, THC, CBD, but we don't know what's next. We don't know what's coming forth, but we can follow the trends and we can continue to learn and be the experts in the area that we currently live in. Next slide. So going into our various vaping programs, so Ricky and I got together and we found 3 programs, or our top 3 picks for vaping programs based on experience, research, and what we found. So this may be, these 3 may be curriculums that I know that some of you have used because you did mention that in the chat, but there may be some that are new to you. And feel free, I'm seeing people put information and resources in the chat. Please continue to do that because the more resources we have around this issue, the better. Next slide. So the first curriculum is Catch My Breath. So Catch My Breath was developed by the University of Texas Health Science Center at Houston. So it is catch.org. This particular curriculum addresses nicotine and new to date marijuana. I just received information that now they are including marijuana curriculum, education materials, activity materials related to this curriculum and vaping. So that's a new feature that just happened within the last month or so. Interesting about Catch My Breath, it's the only peer-reviewed evidence-based vaping prevention program that we currently have. And so that kind of sets it apart from the other curriculums or programs that are out there. This is a free curriculum. There is a charge to be trained as a trainer. So if you would like to be a trainer of trainers and train your community, there is a charge for that training, but to access the curriculum, it is free. And they have ranges from grades 5 to 12. and they include ages 10 to 18. So if that covers your grant funding, if that covers your program and activities that you're currently working with, this would be ideal for that. One of the things that I like to point out about Catch My Breath also, the system is very user-friendly. It was guided and planned and promoted by a group of youth. So you have a lot of material in there that comes from the voices or the impact or experiences of middle and high school students. This curriculum has 4 sessions, and each session is 30 to 40 minutes. So when you go into a classroom or when you're presenting this program to your school board or school administrators, just make sure they know that it only takes 30 to 40 minutes each section, and it's only 4 sessions. A good thing about Catch My Breath also is that they have their own pre and post tests included, so you don't have to pay additional fees or funding for the actual creation of an assessment to determine if you're providing the information effectively. Next slide. One key point, as I mentioned about Catch My Breath, it is the only peer-reviewed and evidence-based curriculum. And so it has a lot of that data included. One of the things that they also include on the site are graphs, as well as how you can link these standards or this curriculum to the standards that are set forth within the school district or nationally for educational standards. So with this slide alone, it speaks volumes. What they've identified here is that the program impact on the average middle school 7th grade class, they will have 17 students will try e-cigarettes without doing anything. There's no intervention, no prevention, no anything. And then if you do implement the Catch My Breath program, you will have 8 that will be prevented using this program. So eight students that will not use vapes based on the implementation of the Catch My Breath curriculum. Next slide. So the next thing that we program we want to talk about is Vaping, Know the Truth. So this particular curriculum was developed by Truth Initiative and Kaiser Permanente with the help of the American Heart Association. So this curriculum primarily covers tobacco and nicotine. So it covers vaping, but it also covers trends and history and facts associated with the traditional cigarette. The curriculum is pushed through by a research-based organization, EverFi. So one good thing about this curriculum, again, it is free. So it's free to your communities to use. It's free to the board, the district members, staff members to utilize this curriculum, and it is available for grades 8 through 12. It is also available in Spanish. So if that will fit your demographic for your community, that is already available. So you don't have to worry about translation services. The important part about this curriculum is that it's only 5 to 10 minutes. So there's little snippets. So there's little snippets of information where you don't have to facilitate an entire class, but maybe you can provide that information to a teacher or instructor in class to do at the beginning of the class or the end of the day. And it won't take up as much instructional time, which is a big selling point for the school districts and board administrators. And again, with this one, it also includes a pre and post test. So there's no additional funding needed for evaluation. Next slide. So as you can see, this is a screenshot for Vaping, Know the Truth. So in this screenshot, it identifies the 4 objectives, and these are the 4 objectives that are identified for each grade level. So the know, the uncover, overcome, and change. And then it also gives you the 4 lessons with the 5 to 10 minute increments. So to include this entire curriculum for 8 to 12 graders, each grade level has a total of 40 minutes to do all 4 lessons, which can be a huge selling point for some school districts because you're not infringing on that additional instruction time or delaying any other assessments or anything that needs to be done within that class time. All right, Ricky, back to you.
All right. And the third one we want to mention today is by the Stanford Medicine. They developed several different toolkits, one being the tobacco toolkit. And then they created You, Me, Together, Vape Free, which is a theory-based and evidence-informed curricula. It was developed, like I said, by Stanford Medicine and then Stanford Reach Labs, the Youth Action Board, several different healthcare providers and scientists gave input into the development of this curricula. So that means that there's a lot of science backed behind this. And while it's not fully dubbed evidence-based, it is evidence-informed and theory-based. And so this is another great program that is making the strides. And of course, as it says on the slide there are pre and post surveys, just like these other, that help to measure whether or not that is making a difference with those youth. And so therefore that helps to build that backing for that evidence-based designation. This one's also free. It does, you can download different PowerPoint slides, but they also utilize Canva. I know that Canva has become very popular in school districts and with youth. Canva has kind of taken over PowerPoint with the younger generation. And so you can use Canva and be able to sort of edit some of those slides. It is available for elementary, middle, and high schools. So the middle and high schools are 6 lessons that are 50 minutes each. However, there's the elementary option is just 2 of those 50-minute lessons. So age appropriate for that age range, but another great option that really spans a lot of that earlier age as well, to help sort of instilling some of these things. And it teaches really great, refusal skills on top of just sort of giving them that knowledge about that harm. They have these really great worksheets that they utilize in the curriculum. And then also the youth can take home discussion guides. So they can talk with a trusted adult, whether that's a parent or a guardian or a trusted adult in their neighborhood or in their school that they really like. They can have those discussions with them and ask some questions about what they've learned. And that's a really great way to help sort of root that understanding about vaping in the youth's mind and help them to fully understand that. So just a quick snapshot taken from their website, that the goal of their program is to increase that knowledge about harm, which, as we talked about earlier, that perception of harm is very low for e-cigarettes. So it helps them to understand how harmful e-cigarettes are for the body, as well as gain awareness about those marketing strategies that we just talked about and how these have been targeted and sort of made to look appealing to youth in those deceptive ways, as well as gain that refusal skill of how to say no to the use of an e-cigarette or an offer to take a puff or a hit. And then finally, ultimately, they want to reduce the use of e-cigarettes by youth. So another really great program. There's a few more resources we wanted to just offer. These are great resources. They have different posters that can be put up in the schools. There's different campaigns. And so while some of this you may just want to jot down right now and make a note of to go and look up, you also, when you access the slides in a few days, you can come back to this slide and take a look at this. But different access to cessation and quitting resources, such as texting Ditch Vape to 88709, and that can help young people to quit vaping, as well as some real costs campaign and the Quit Now hotline number. So lots of different things available there. I will say that while we are only covering 3 of kind of the most research-based that we have uncovered, that Tanya and I either have experience with or in our research discovered, there are a lot of vaping curriculum to dig into whether or not they are evidence-based. If there's anything we have learned in the field of prevention over the last 20 years, really 40, 50, if you want to go back in history, it is that research needs to be backing what we are choosing to do. I'm sorry, one second. Very sorry about my allergies. Research needs to be backing what we are doing. We need to make sure that we are following the science and educating youth in a way that is effective, not harmful. And so definitely whenever you're looking at vaping curricula for your school, we want you and encourage you to make sure that you do that research, know exactly what it is proven to do or not do, and just make sure that you are doing your due diligence there. What we would not want for you to do is promote a program to your schools that's not evidence-based, and then that could cause a fracture in relationship with your coalition and that school district if that program ends up not working out or being something that is successful in the school. So definitely lean into your resources to find evidence-based or evidence-informed programs and policies and implement those with fidelity so that we make sure that we are staying as tight to those programs, knowing that they will be effective with their target audiences. So just a little encouragement to you in that, as I know a lot of people are offering some different programming in the chat. Take that, do your own research, and find out what is going on there. All right. So let's transition into talking about how to engage with your schools. One of the things that I presented was some data, and that was on purpose because we need to start with some data and information that we can then work to engage our schools with. Find the data, hopefully local data, that will support your need for it in your schools. If you are a drug-free communities grant, if you are a grant or a coalition that is operating from the strategic prevention framework, you likely have a needs assessment. Maybe it's a little old, maybe you need to dust it off a little bit and refresh some of that data. But if you have data that you are aiming to kind of find out what your problem areas are in your community, look back at that, look at vaping data, and then you look at how you can, kind of frame that for your school district to be able to see that this is a problem that's happening. So I listed some options there on the slide. You can read those. So sorry. Option, you can read those. Past 30-day use rates. So I shared that earlier. 2.5 million US middle and high school youth report that they're currently using. Well, what's the percentage for your community? How many of your youth are reporting current use of e-cigarettes? And if that number is higher than the state rate or higher than the district next door or the county next door, you want to look at data, compare it to what's going on around you and in the United States, and see how that might be a data that is compelling for your school district to take a look at. We talked about perception of harm already, and that we're seeing that increase a little bit, but man, if it's still at 22%, that means only 1 in 5 of our youth are reporting there's great harm to use of e-cigarettes. And we know that that's a very harmful thing for their bodies, especially developing bodies. So looking at that perception of harm data and how a vaping program that is intended to educate them on the harms would, in fact, change their perception of harm. So using that as data that can help compel your schools to want to include a vaping curriculum in it. Reported peer use, that's just helpful for you to be able to communicate to the schools, maybe how culture is at the school in terms of vaping use. Is it common? I mentioned in my introduction, I train with CADCA on the youth side, and each conference that CADCA holds, we do a youth training, and there's a whole youth wing to it. And it's so fun and exciting. And those youth come up with strategic plans for how to address what they identify as their problem area in their community. And I can vouch that the majority of them end up selecting vaping because they're saying, these youth are coming to conference saying, this is happening in my schools. I know that kids go to the bathrooms at schools and they vape. Or I know that they're behind the bleachers at the football game vaping. And so the youth that I have access to are also reporting this. So if there is this reported peer use, that can also help give the schools an idea of the culture and what's happening there around that. Reported use, I believe that's supposed to be use. I apologize for that typo. Reported use of themselves or of maybe even a parent. Sometimes that can affect how wrong or how harmful that they think that it might be. If your school or community has a vape collection box, that's kind of been an interesting evolution in the last couple of years, is that people, very similar to a prescription medication drop box, that people are installing vape collection boxes. If you know how many vapes were collected in one of those, or if your school resource officer can provide some data to you on how many vapes they have confiscated from backpacks and students coming into the school district, that would be interesting information for your schools to know about. And then qualitative data, getting behind the numbers and asking why. What's happening here? Having youth focus groups, talking with youth about this. They are very open to talk about what they're seeing with their peers and what they're experiencing. And so have some short listening sessions or focus groups with some youth so that you have some understanding of what they're seeing and experiencing, but potentially also that sort of qualitative information that you can take back to school districts and say, hey, there are a group of youth in our community who really want to see this epidemic come to an end here in our local community. So let's do something about it together. And then ISS, in-school suspension, out-of-school suspension, and the effects of that. How many students are getting in trouble for having vaping devices on school? And is that an in-school suspension, an out-of-school suspension? And while we aren't talking at great length about cessation or alternatives here on this webinar, it is important to know that data so that you can maybe talk with them. If students are getting out of school suspension, if that's part of that school's policy, if you're caught with a vape, since it is a drug on school campus, then then you're losing students and their attendance in class, and school attendance records are very important to them. Also, if they're in school suspension, if those numbers are increasing, well, you've got to have more staff to be able to be around those students with in-school suspension. So a lot of different nuances there that data can bring to the conversation that you're having with schools to work on getting them engaged in having that vaping program there in their school. So having talked about data, it's also important that you let your people do the talking. Who do you know that you or your coalition members can go and talk to? In the world of prevention, in the world of, sort of this nonprofit, we're doing good for the community, it truly does come down to who you know or who knows who. And having kind of the guts in your coalition meeting to say, hey, who knows anyone at the school level that's willing to go and have these conversations? And if you have conversations with them, sharing that data, sharing that information, you're going to start that conversation, and hopefully there's a momentum that begins to build. The more people who are able to have these conversations with individuals, whether that's the superintendent, whether that's the nurse, whether that's the school resource officer, a school board president, whoever those individuals are, you are having those conversations in multiple different ways for multiple different people, that really helps to communicate the essential message that we need this vaping curricula in our schools. So I put on here, like, what's your in? Who is your in, or what is your in? Did you have an incident at the school that would be a great launch point for the coalition to be able to come in and talk about this with administrators? Or is the data really that driving need? And then who's your champion? It could be anyone in the school. In my experience with youth coalitions and helping to build youth coalitions in my community, I have found that the front desk staff of the schools, whether that's a high school or a middle school, those individuals sitting there at that front desk to welcome guests and to sit with students while they're waiting for parents, they are the gatekeepers of information. They have loads of information about students, about kind of trends, because they're sitting there absorbing a lot of what happens in an office, whether that's a student being picked up or a student being walked back to the principal's office to have a conversation, or the school resource officer. Those individuals could be one of your biggest champions, but often they're overlooked because people typically think about the superintendent and we have to go talk to them. Absolutely. If you have a relationship with a superintendent, go and have that conversation with them. But also, if you know someone who works in the nurse's office or in that front desk staff, or a coach, or anyone there at that school district that you think would lend an ear, lean into that and have that conversation. And of course, we stress these 3 programs. There are others out there, like we mentioned, but familiarize yourself with them before you go in and have these conversations, so that you're able to speak with authority on the cost, on the commitment, and on kind of the expectations that would be there for those schools. Because if you walk in and just kind of say, hey, we really think it's important to have a vaping curriculum here, and they say, okay, tell me more about it, but you don't know how many lessons it requires, or how long those lessons need to be, or how much it costs, or do my staff train it, or do you come in and train it as coalition members? Having that prepared ahead of time of what you're going to share with them will go a long way in engaging them, in terms of them knowing exactly what's expected of them, so they can meet that and not feel blindsided when things get added on later. Tanya, you've got a few things to add too on engaging school districts.
Yes, I do. Next slide, please. So when we're thinking about engaging our schools, so Ricky, thank you for that. And I'll kind of piggyback on that information as far as data and knowing our champions in the community in our next slide. But before we get to that, when looking at engaging our schools, we need to know our approach. So it's important that when we have these conversations and when we start these conversations, what kind of approach are we having? What are we introducing to these individuals? What are we introducing to the school district? Are we on the side of prevention, where we're providing information, where we're giving all of the curriculums and the prevention education to the community and the students? Or are we on the intervention side, where we're doing more of a reactive consequences approach to our programs and our activities? And so with any of the three programs that we mentioned, and several of the ones that you all have mentioned in the chat, we're on the side of prevention. We're looking to provide some kind of education curriculum, or you do something around awareness weeks and different events within the school district and in the community to provide education, as well as more information about the harmful effects, perception of harm, and then addressing like our 30-day use that we're collecting from this data. When we move to the side of intervention, this is the more costly approach. As research has shown, as statistics have shown, you save more money when you're doing prevention than you do if you take an intervention approach. So if we're only looking at creating diversion programs or intervention programs, we're losing a lot of our students. We're losing a lot of the majority of our middle and high school students that are still trying to decide or have made their minds up, like, this is something I don't know, I don't want to do, but I don't really know why or why not. So we're missing that population. With their interventions, these are after the fact. These are the more reactive consequences and occurrences that happen because of something that's happened on campus or something that's happened in our community. So that's where you hear more about the diversion programs, the intervention curriculums, as well as referrals to different substance use agencies. Next slide. So when looking at prevention versus intervention, it's two different approaches. So as we mentioned before, with the preventions, you have the curriculums, you have the awareness weeks, you have all of the things that we can provide information, education to help make these decisions easier for youth and help to provide them and the communities with more information about what's going on in our community. So that's more of a universal approach. So it's addressing the entire population, regardless of incident, regardless of use, the entire population, whereas intervention is more of an indicated approach. So for my public health piece, people, I'm sure you're familiar with these terms. So the indicated portion of the community are the individuals who have identified something. So we've identified, hey, this student was caught with a vape on campus, or this student came to school high yesterday. So we've identified some kind of sign of substance use or some kind of issue related to substance use. And so that's why the intervention piece is more costly, because you're spending more money on assessments and referrals and different tools that you need, as well as bringing in professionals to assist with this, whereas it will save more money on the prevention side if we started it earlier and with all the grades and not just select individuals. Next slide. So that brings me into the power policy. So as Ricky mentioned about the data, about knowing your champions, all of those things are important when we have these conversations with our school district and our school administrators. So the first point with the principles of effective public health policy change is use your evidence or research to inform policy. So knowing those data points, knowing your past 30-day use, talking to your young people, figuring out what's going on in their social circles, figuring out, hey, what drugs are they seeing in the community? What is their experience with having different vapes or having different instances where they're exposed to different things, as well as looking at other counties, looking at other school districts. I know one of the things that I was asked when I approached my school district was, hey, are they using this program somewhere else? Is it working? So knowing that research when you go in to have these meetings. And then the next thing is consider the health equity of the students and the family. So understanding that you want to be fair. You're looking at the wholeness of the student, the holistic approach of the students and the families, that you want to identify not only that, hey, I'm providing this education curriculum, but also I want to make it where we're, addressing truancy, we're addressing the social climate, we're addressing the overall child and helping provide resources and additional services to the families. The third one is create policies with implementation and evaluation in mind. So as Ricky mentioned, go in with a plan. So if you're going to use Catch My Breath, go in and say, okay, this is how we see this implemented. These are the classes that they could be implemented in. This is how much time it will take. This is how much time it will train your teachers to be facilitators for this, as well as what that evaluation will look like. So will it will we be able to do the pre and post test in that current session, or will we have to set up different times? And then looking at the trend. So allowing the school district as well as the administrators to know, hey, you know, that we have this evaluation piece, and we're going to make sure that you are receiving that data. We're going to make sure that we respond to you and let you know that we are consistent and doing this effectively and with fidelity, so that you can give this to your shareholders and your key individuals like on the board, so that they know that we're doing good work here. And then the last piece is using a proactive research policy to inform the school system leaders. So you want to make sure that we're giving the translation strategy. So the same way you and I learned about different vape products, or the same way that you and I learned about the approach to prevention, those are the same tools you have to use with your district officials. That's the same approach you have to use with your school staff. So giving them the basics so that they can speak with confidence about what they're doing in their school district, about what they're doing with their students and their families, so that they can make informed decisions. So giving them the basics, showing them what a vape looks like, showing them how it can be hidden or concealed, taking them through your process. So if you're using the strategic prevention framework, taking them through that process to understand like how you got to the point where you feel like this curriculum is the most effective curriculum for the community. All right, next slide. All right, so as you gather all of your information, so you got your data, you got your champions, you've identified how you will implement it, you identified how it will be evaluated in your community, and you have the tools that you need to do assessments and build capacity. Now let's go for the resistance. So when you are approaching these different bodies, you got to know why. You got to know why you're engaging the schools. You have to know why this is important for your community. A lot of communities have their special stories or their community interests. So if there's been an incident that happened in your community that made a heightened awareness around vapes or e-cigarettes, bring that to the table. Let them know what happened and how this solution can affect this not continuing to happen again. Know what's in it for them. A lot of the school districts and school staff are like, okay, how will this benefit our school as an entire body? So informing them about lower truancy issues and increasing their graduation rates as affecting their, as well as affecting their school climate. When you're not dealing with substance use, you tend to have other things that may be going on, but also if you're able to address individual things, you're able to get to the root cause of why students may be doing certain things. So you're affecting the student as a whole and addressing the entire climate and the entire population of your school, which makes it all better. Knowing the common goal. So why are we doing these curriculums? Why are we providing this prevention education? And so what is our goal? So do we want to develop healthier adults? Do we want to decrease the likelihood of substance use disorder? So when you provide this information to the school district or to the school staff, understand this is our goal. This is why we're doing this. This is what we want to accomplish. And so that when they go in to speak or represent their program or represent you in front of like the Board of Education or your Department of Education, whatever you have in your city or state, then they can speak with your goal in mind, and you all share the same goal and share this common message. All right, Ricky, back to you.
Well, if you haven't seen it yet, in the chat, I dropped a link to a Google Doc, and that Google Doc will allow you to enter in some responses. We thought we would have some time to look at how you all have engaged your schools successfully, but also maybe some of the challenges you faced. But here's the deal. If you put a challenge, you have to put how you have sought to overcome it or how you did overcome it. Just because we want this to be a really helpful document. You all can save this. You can make a copy of it once all the results and answers are in there. And I see lots of people chatting in there, which is wonderful. I love to see this. I've also been, as you all are filling that out, I've also been looking through some of the chat and the Q&A. And Tanya, I think we could probably just start, you may be using some of this time to answer some Q&A while individuals are filling out that Google Doc. But one of the things I saw pop up in the chat is about the disposal of vapes. And it is very important that you follow your local law and legislation around the disposal of vapes. So if you are collecting them, and there's actually, Katka had an article that came out about a coalition, an area actually here in Southwest Missouri that was doing that. And essentially what they found successful is what they had to take apart the battery from the vape. So the vape device with the nicotine in the pod was able to be disposed of at take back events or at take back boxes, but the battery had to be taken to a local battery disposal location. So it is important that you follow those laws and legislations that are in place in your area to make sure that vapes aren't just being thrown away, because there are some definite issues or concerns surrounding that. So wanted to mention that as something to be aware of. And anything else you're seeing there, Tanya, that you want to jump in and Q&A and the chat that you want to mention before we go to this Google Doc?
Well, I see a lot of things about the different substances that are included in vaping. And so just to address, I know with drug-free communities funding, we're told that we focus on vaping as a mechanism to use other substances. So when we use the term vaping, it's just the mechanism. So it can be any substance. That would depend on your community, on which substance you're seeing most often, which substance you're seeing that is making a larger impact on your students in your area. But for vaping, it's just the mechanism of smoking a substance. So it could be any substance. So it could be the nicotine, it could be the marijuana, THC, TBD, or any other substance that they've identified in the vape. So just to clear that up.
Yeah, thank you for addressing that. The other thing that I saw a few questions about data and how to find data in your community. And as a coalition, you may have access to some data already. There's maybe some archival data or data that already exists that you can tap into. Typically, school districts have some sort of survey that they do with youth to measure a large variety of things. So some communities have those. You can also access things like health department data or school resource officers, having conversations with them. The data could either be quantitative or qualitative. So whatever is available to you, and we find out if there's any survey being done in your local area from youth or adults. If not, you could certainly work towards developing something like that. But if not, then maybe some qualitative information. Call the school nurses, the school resource officers, have a focus group with youth and just get an idea of some of that information that might be out there. And so that's another thought there too. Let's see. All right. I'm looking at this Google Doc and it is transpiring into something just absolutely beautiful. So I'm looking at it right now, and there's several things on here for those of you who maybe haven't accessed that. I can drop the link again in the chat. I'll do so right now for those of you who maybe missed that. But I'm seeing some different things. So one is right at the top there, I think this is a great way to engage schools, is to have the school be part of a fiscal agent. It looks like their school administrator or their school district became the fiscal agent for their coalition. So that then means that the coalition staff person is actually a school staff person. And that has really helped them with engagement within the school. So that's a really neat opportunity that coalition has. When I read petting zoo, Tanya, I'm not going to lie, I thought about Winnie the Pooh fish, but that's not what they're talking about.
Right?
They're talking about kind of a look and feel experience for teachers and parents to understand what vapes are about. But also, if it was Winnie the Pooh fish, I would have showed up for that.
Me too. It's cute fish.
What else do you see in here, Tanya, that are sticking out to you?
Well, I know there were several questions about Spanish translation. So the one program that I did discuss, which was Vaping Know the Truth, is offered in Spanish. However, I also know that Catch My Breath has some translation services. However, I'm not sure if the entire curriculum is translated in Spanish. So that's a really good question, and I'll continue to look and research and see if I can find out more information about that as we provide this information to you all. But I know for sure that the Vaping Know the Truth does currently have a translation in Spanish, and it is only for grades 8 through 12.
Thank you for that. Yeah. And if there are any questions, you can use the chat. We've also been using the question and answer option that's here on the webinar as well. And so just looking through some of those, The states that benefit the Juul settlement. I know that there were several. I believe that it was California and Texas for sure. I can look up an answer to that in just a minute. I might kick it back over to Tanya to keep talking through the document that's popping up or any of the questions. I can absolutely look that up. I think that there were 7 or 8 states that benefited from that. I see there in the Q&A where to find the Catch My Breath, and I believe that Tanya put that in the chat. It's catch.org. And so you can access that there. And there's a community data question that we did just address. So yeah, a couple other questions are popping in here, but let me go and find that answer. And Tanya, I might kick it over to you to just talk through a few other of the successes or challenges that you're seeing that really stick out to you.
Perfect. Thank you for that. And so I'm seeing several comments about how you all are engaging your school district, which is awesome. So someone mentioned that the school district partners with the organization to provide translation services. So that's something that your community could look into, because there's a possibility. I know for my community, there are options to have translation for different classes or curriculums. And so looking into that may be an effective tool to provide translation, especially if you need more than Spanish. So the school district may offer multiple languages based on their student population. And then I see there's a lot of conversation about flavoring. And so the ban was put in place to prevent the flavors from being distributed, except for the menthol flavored or the tobacco. But unfortunately, our youth are smart. So they figured out some ways to get around that. And some manufacturers and companies have figured out ways to get around that. So what's important is to do your research and to figure out what's going on in your community. I know that I've heard several communities mention social media is a way that things are getting to their youth. So looking at different programs like Instagram or Snapchat as a means for accessing the flavors and the other vapes, as well as looking at the different manufacturers that may be sold in your convenience stores. I know one option was to do an environmental scan. So going into your gas stations and local convenience stores to see, okay, are you selling vape products? And if you are selling vape products, where are they located? Are they located by the Snicker bars and the candy bars? And so just seeing what you have in your community, and that way you can provide messaging and provide education around the flavoring, and making sure that parents are also aware that these things are being sold while they're pumping their gas. So that's one of the things that I have seen in the chat. And I see, Ricky, you're back. So were you able to find that information for us?
I did. And I dropped that in the chat, but it was the states of New York. Oh, hang on. I got to find it. Where did I put it in the chat? 1 second. I got to scroll a little bit here. I love how active this chat has been. So the Juul settlement was with New York, California, Colorado, District of Columbia, Illinois, Massachusetts, and New Mexico. So for whoever wanted to know that information, there you go. You know, I'm looking over here also at the challenges that you have experienced, and one of them is competing priorities. And that's absolutely a very valid challenge. School districts have a lot that are put on their plate these days. There's a lot of expectations and requirements on them. And so you definitely want to be mindful of the fact that you're walking in asking them to do one more thing. And I think acknowledging that goes a very long way to just be able to say, you know what, this is a growing problem in our area. And that's why that data is so helpful. If you've got some comparison data either over time or with neighboring areas to show that it really is an issue in your community, and that you have youth, maybe even take youth with you to communicate to the school board or to a superintendent or whoever, so that they have that voice. Because those competing priorities really do create a little bit of a barrier, because it may not be something that is top of mind for them. And so the solution that group came up with was making vaping prevention stuff easily accessible. Simple content, simple materials, handouts, brochures, maybe one of these easy curricula that can be implemented, and knowing where to refer students and those who have maybe been caught vaping. So that was, I thought, a really great challenge and way that they overcame it. I know there's some challenges popping up with policy, but I think Tanya did a great job covering that with just talking through how to kind of best get your foot in the door regarding policy and what those individuals maybe are most wanting to hear and to know about.
I am loving the level of engagement on this document. I can't keep up. I'm trying to I'm trying to keep up with these responses.
It's really great. And what we wanted for you with this process is that this will be here. You'll be able to come and access this link to this Google. So you can always come back here and get some ideas or get some thoughts that you can take away with you. And you know what, once maybe some of this dies down a little bit, I know there's gonna be a recording later, we could get this into a PDF format and post that with the recording. Of course, that would mean that, you know, kind of ends in terms of the live document, but at least you could get some of these solutions too. That's great. Just reading through some of the chat here. I think this is so good. Oh, and I've seen the comment, the barrier about OSS, out of school suspension, being an issue because it allows those students to then just be home vaping.
Right.
And that absolutely is a valid concern when it comes to that. It says our coalition communicated these concerns to the school system and can now report successfully providing vaping education. It looks like, yep, there we go. In one middle school, that vaping education instead of that OSS. So that is fantastic.
That's awesome.
Yeah, that's really
awesome.
Great.
And that's one of the things that I noticed. I don't know what curriculum or what program this community may be using, but I know that Catch My Breath also has modules that you can provide for in-school suspension. So if a student has been placed on ISS instead of OSS, they can complete these modules and still stay at school. So I know that is an option with that curriculum. So great job.
And, you know, I'm seeing too, one of the other things that I'm noticing here in the barriers is that, which kind of just, you know, corroborates what we were talking about earlier, that schools have pushed back about whether or not programs are evidence-based or not, whether or not it's going to be effective. So that just goes to what I said earlier, how important it is that you're doing your research and finding the right program that will be the right fit for your school and meeting that need in a way that will align with their priorities and what they need. Because that, you know, if you walk in and you say, well, I have this 12 lesson curricula, it's not evidence-based, but it'll solve your vaping problem. Well, they may not be able to facilitate 12 sessions. You walk in with 2, 3, maybe 6, then that's maybe a little bit more doable. So just being mindful of that as well.
Right.
And to Tanya's point in the slide that she talked about, one of the barriers is listed as lack of understanding on the importance of prevention versus intervention, and that more emphasis is usually placed in schools on intervention because it seems more tangible. And that's exactly why we wanted to cover that part, because that's what we're seeing as well in our experience across the nation in training is that schools are typically kind of being more reactive to this vaping issue than prevention focused. And so you all coming to the table to offer a prevention and really, you know, promoting the fact that an ounce of prevention is worth a pound of cure, and really showing them how preventing this problem from even starting and reducing youth use early on is far more important, you know, to be getting that message out there so that hopefully they don't have to be facing these intervention concerns.
Right. Because prevention definitely will save the money in the end. It will definitely save the school district, the state, the country, in the end, when you're doing a comparison of how much money we're putting out for intervention versus prevention. So
yep. Data. I'm a big fan of getting your data and following the numbers, following the data.
Right.
You know, it's just that needs assessment leading right to what your real problem is.
Ricky, since you mentioned a needs assessment, can you touch on, I know it was one of the Q&A, how some ways coalitions or just community leaders can find data, how you can get community data real quick?
Yeah. I mentioned just really briefly things that are archival that are there for you already would be great, like things like health department data or emergency room data, or if your schools are already doing some sort of student survey. I know in my state there's the Missouri student survey. Several other states have different ones. There's also, you know, monitoring the future can sometimes get at least state level data. or there's several others that are, national level. But the more local you can get, the better, because some of that data is going to really drive that need in your school district's footprint. So if you already have a school survey that's happening, that's great. But other qualitative data could be things like youth focus groups or key informant interviews with the school staff, the principal, the nurse, the SRO, people who are really interacting with this on a regular basis and getting that information that can kind of have that show of what's going on there. Yeah.
And it's good, just to piggyback on what Ricky is saying, it's good to have a balance of both. So if you have surveys, so if you're getting that data from your state level or the school district, if they have their own data source and you're getting those surveys, it's still a good idea to talk to the youth, to talk to the community, to figure out exactly what's going on, what they're seeing. So having a balance of that qualitative and that quantitative data when you're going into these meetings, so you can say, hey, we've had a community forum with 30 youth and this is what they said. Or we've talked to 15 of your students and this is what they've identified as issues for your school. So it's good to have a balance with that as well.
Absolutely. Yeah. And health departments, I mean, wherever you can find some access to some local data, that would be really, really helpful for you. That's great. I know that some people have already asked about our contact information, so I wanted to get this slide up here with our emails. So feel free to email us if you need anything. Of course, I know that CADCA is planning in the next few days to get the recording and the slides posted on their link, Webinar Wednesdays. And Samantha, well, if you could drop that in the chat one more time. I know you've put it in there a few times, but in case anybody missed it, that chat is flying fast. And so go ahead and access that in a few days, where you can get the slides and this recording, as well as we'll kind of put an end to the Google Doc once people have time to get in there and finish their thoughts. But I'm loving reading this. Some of the successes you all are having is huge. Doing roundtables with the parents as well as school administrators, huge. That's a great success, because you're able to start communicating about what's happening, about some of that data, about some of the problems that they're facing, and really showing them that there is a need to be educating youth about this. I remember seeing some of the chats that were referencing, that youth are accessing them either through retailers, and that some of those retailers are within close proximity of schools. And that is definitely something that you can look at in a needs assessment and kind of look at your whole community and figure out, how are youth getting access to it? Is it through retail stores? Is it through friends and family that are giving vapes? Are they taking vapes? One of the common issues that I've heard from youth specifically is that they're sharing vapes. So, which is a hygiene issue in and of itself. And so there's just that issue of the sharing that's also happening, and that's how they initiate or use their vape. So just lots of things that you go out there and get data-wise.
And I wanted to encourage you all with is, you all are coming up with great solutions. So this is not the work of the wealthy. This is not the work that you get into because you want to make a lot of money. So your passion here, your drive is here, and I can see that on this document. So just continue to do the work that you're doing. Continue to try to pour into our youth in this community, and we'll see the difference. We will make a difference, and we are making a difference day by day, child by child.